But basically, it got very difficult for them to continue. Only the most politically connected ones were able to continue. The AMA went after these physicians. They had their licenses pulled. They warned them in the Journal of the American Medical Association, at the time, still is, and at the time, one of the world's top scientific medical journals. And yet they're also using it to say, hey, let us turn around and warn physicians, don't you dare try to join one of these prepaid physician groups, or we will come after you. We will take your license, and you will have wasted all that time in medical school, and you won't have a career. So, a prestigious scientific journal, yet they still found room to threaten their own members, or maybe even physicians too who weren't members. So
why did they go after them though? Like, I have so many questions about all the other things you now said, but I wonder, why did they go after them?
Such a good question. And this is where, isn't it so funny when you look at the primary sources, how they tell you things you don't expect, and sometimes you try to argue with them, but hey, they were there. they made the sources. So this is where I was arguing with my sources, because the AMA has always been so well known for fighting government intervention in healthcare and fighting socialized medicine and fighting universal healthcare and healthcare reform. A lot of scholars have just assumed, therefore, they were pro-free market. I fear that sometimes historians read too much of our current day circumstances back. Like, they think Democrats and Republicans were the same, 120 years ago, and they're not. You need to understand that the issues were different, right? So what people do not realize about organized physicians is they were just as opposed to the free market or the competitive market as they were the government, maybe more so. And that was what, now some scholars have noted this. They haven't, they talk more about the models they're against, but without coming out and saying, look, they were horrified about the idea that a physician would enter a competitive market and act and compete against another physician. To them, that was crass. That was dirty. That was for the, that was for the lower sorts. They were experts. They were scientists, they were, right. And we see how all professions, we professors do this, right? We all, journalists, we all think very highly of our professions, right? Well, this is them putting themselves on a pedestal as well, saying we're not going to enter into that dirty marketplace and compete against one another. No, we snatch life out of the jaws of death. We're there for the most important moments. We're the scientists. We blend science and art. And how dare you suggest that we would just be like, a regular old store owner or a regular peddler. So they would call these prepaid physician groups like supermarket medicine, if that gives you an idea. Think also too about this period. You have the rise going on, because you got kind of the second phase of the Industrial Revolution has been unfolding behind them. You have the rise of the large corporation. Yes, we're accustomed to them today, even though of course we criticize them a lot, but you can imagine how frightening this is for people seeing the world quickly be organized into corporations in these commercial units that are very large, right? Bureaucratic, almost seem faceless, hierarchical. The physicians are afraid of getting pulled into that. And that's a rational fear. They would look, for example, say if they looked at the profession of engineers and say, the engineers got pulled into the corporation, right? And what the physicians don't want to happen is to be answering to some union boss or something, right? To some manager, because they're pulled into the corporation. You have these healthcare corporations, right? You can almost imagine what they're thinking, right? And they become salaried employees who work for people who don't even know anything about medicine, but they work for them. So this is the fear they have, and they're very afraid that these prepaid physician groups are kind of like the beginnings, right?
Like the step before it, because the prepaid physician groups themselves didn't have that problem, right?
No, but they're looking at it as a nascent corporation because you have capital pooling, right? You have prepaid plans. They didn't like insurance either. They get dragged kicking and screaming to finally approve insurance, because they're afraid insurance is going to lead to these healthcare corporations, supermarket medicine and stuff. And that physicians are going to have to compete against one another to get jobs, or compete against one another very vigorously in the marketplace. Even where physicians practice independently, in their own practices. All the AMA ethics are against any type of overt competition. You can't say anything bad about another physician. You can't question what another physician has done. You can't try to take care of another physician's patient. I mean, or you will lose your license. You will get kicked out of your little local medical society and lose your license. And the thing about the AMA is as big as the United States is, they do have eyes and ears everywhere, because the way they have their organization set up is really brilliant. They set it up to mimic the federalized system of the United States. So they have local medical societies on the county or city level. Then you have the state medical society, and that feeds into the national medical society. So you're going to have one of those little local societies somewhere, the eyes and ears of the Chicago headquarters, looking to see if you're doing what you're supposed to be doing, right? And so that explains some of the power they had. But yeah, they're very worried about commercialization of medical care and healthcare, and them losing their autonomy, right? Working for non-medical people, being forced into a situation where it's very competitive and they're competing against one another, much like entrepreneurs, and business leaders compete against one another now. And insurance also, the other problem with that is even if insurance companies get involved, they don't like that idea either, because then the insurance company can start to get power in that market. But they do everything they can to shut down the prepaid physician groups, and they do a good job of that. They really do prevent them from going anywhere. I maintain that if it hadn't been for the AMA, that would have been the dominant model.